proximal and distal. Like when we talk about the fingers and we talk about these joints here, you have a proximal interphalangeal joint and a distal interphalangeal joint. So proximal is always moving upwards towards this. Let's see. Proximal is closer to the origin or the center of the body, and then distal is away. Because then, a lot of times when you're talking about point location or something, it'll say, this manicule distal to the lateral malleolus, or proximal to this, or medial to this, and lateral to that. And then you're going to have superficial and deep. So obviously the skin is going to be more superficial, and then anything below that is going to be deep. Like some of the muscles where you say there'll be flexor digitorum superficialis, and then there's flexor digitorum profundus. And one's going to be deeper, and one's going to be more superficial. And then you have external and internal. And that's basically more or less the same as almost as superficial and deep. Then ipsilateral and contralateral. So ipsilateral is meaning the same side. So you may talk about, let's say if there's a muscle on this side of the body, and then it's lateral flexion, you would say it's ipsilateral lateral flexion, because it's laterally flexing to the same side, versus if there's a muscle on this side that makes the body go to the other side, then you would say contralateral lateral flexion. So ipsilateral meaning on the same side, contralateral meaning on the other side, or opposite side. And then this one, I don't know if that was in the text, but symptomatic and asymptomatic. We won't necessarily get that into this class, but if you're talking about describing something and you say it's the asymptomatic side or the symptomatic side. And obviously if you have pain in your left shoulder, this one is the symptomatic side and this one's the asymptomatic side. And then these are all just, this is out of the textbooks, these are just those same directional terms just graphically shown on the body. So you have proximal and distal, superficial, which also is external, and then deep, which is internal. All right, then there's parts of this here in the notes that I don't actually have on the PowerPoint, but we'll just go over those. And then you have different body cavities. Then you have the dorsal body cavities. Let's see. So basically the dorsal cavity is going to be the brain and the spinal cord. Okay, and then ventral cavities are going to be the abdominal cavity. So you're going to have the lungs, and then you're going to have the abdominal contents. Okay? So this is either going to be the thoracic or the abdominal pelvic cavities. Okay? So you can divide it actually into, you have abdominal, and then once you go below the rim of the pelvis, then you can have the pelvic contents. And then those different cavities of the body are going to be lined with different types of membranes. And you have two different types. You have mucous membranes, and those are going to line things that are continuous with the outer environment. Things like your nose, your mouth, other areas like that. They're continuous with the outer body, with the outer environment. And then these other ones that are sealed cavities are going to be serous membranes. Okay, so those are things that don't open to the outside. So inside of the dorsal cavity, the abdominal cavity, things like that. And then there's going to be connective tissue membranes. There's two different types of connective tissue membranes. One is the synovial membrane, and those are going to line joints. So synovial means egg-like. So if you ever, joint fluid is kind of like egg whites. It's a little bit thick and it's clear. That's what's found in the joints. And in your cartilage, there's actually little crevices inside the cartilage that hold that synovial fluid, so that when you put pressure on a joint and when you move it, that joint fluid will come out to keep the joints lubricated. And then you have meninges, which is another type of connective tissue membrane, and that's what's going to line the spinal cord. Okay? You have the dura mater, the pia mater, and the arachnoid mater. All right, so now, basically, there's going to be slight variations in everybody's anatomy. No two people are going to be exactly the same. There are situations where somebody has all the internal organs switched onto the other side. The heart's on the right side, everything's flip-flopped. So there are variations, but most of the time, 90% of the time, there's going to be structures that are going to pretty much match the way that they're described in the anatomy. Sometimes somebody's blood vessel may have a slight variation. There's some small muscle may be missing. When we talk about the sciatic nerve, there's different variations there, where some people's sciatic nerve comes right through the piriformis muscle, other times it doesn't. So there's little variations. And some of those are going to be more significant. Things like that with the sciatic nerve, that's more clinically significant for piriformis syndrome and things like that. All right, so at this point, what we'll do is take a break, because now we're going to start getting into the axial skeleton. Okay, so now you can all move your skeleton. So basically, the skeleton is divided into two parts: the axial skeleton and the appendicular skeleton. What we're going to be covering now is going to be the axial skeleton. But just to describe what the different parts are, the axial skeleton basically consists of the skull, the vertebral column, and the bony thorax, which is going to be pretty much the ribs. Okay, so it includes the sacrum. But the actual pelvic bones are part of the appendicular skeleton. So the appendicular skeleton is going to be the shoulder girdle, which is going to be the clavicle and the scapula, and then the the bones that come down from that, the upper extremity. So then the appendicular skeleton is going to be the clavicle, the scapula, humerus, and then all the bones of the rest of the upper extremity. And then the innominate or the pelvic bone, and then the bones of the lower extremity. So then the axial skeleton is basically the spine, the skull, sacrum, and the rib cage. So if anybody was wondering what Betty Boop's skeleton looks like, there it is. So then the appendicular skeleton is the limbs and their girdles. So the pectoral girdle, and then the pelvic girdle, which is for the lower extremity. And then there's Charlie Brown's skeleton. So the axial skeleton is going to be the skull, spine, the sacrum, and then the ribs and the rib cage.